XP commentary. And today we're going to do a little follow up on churches, Latinos, and COVID 19. That's the topic for today. So I hope you're doing well. I got to get out for my walk, and I think you all need that to exercise, get out and do that. If you hear anything in the background, it's my neighbor chopping wood with one of these chopping machines. And I don't know, he's got wood he gets. And so I hope you don't hear that. Otherwise, we might hear construction down the street. We're having this street. So home studios can have some problems sometimes on that front. And I'm just a beginner in this, so bear with me. And today's commentary is going to be like I said, about churches, Latinos, and COVID 19. I don't know if some of you maybe seen this today's paper, Pritzker prolonged peak. And it says down here, but the peak's going to maybe be in mid June or July, going to July even, on our peak here in Illinois on the virus, on the COVID 19. So we know that there's a problem in, well, a lot of areas, but underserved, getting higher numbers. Now, I'm going to give you a couple of things right here, right now, to show that. This is a chart from the 8th, and then I'm going to update it here and show you another chart from yesterday. I don't have today's chart yet, from the city of Aurora. You can see there was a little drop here, about 8% or so drop on the Hispanic numbers that we've been talking about quite a bit. And we can see the white number is about the same, and the black number dropped a few more percentage points. So, but we do have an uptick in those who didn't want to respond about race. So we don't really know how accurate some of these statistics are. I'm sorry to say that. So that's the problem. We're trying to address the minority community and the brown community, Latino, and to help to alleviate and bring in more testing. And that's, as I mentioned before, I think Hispanic numbers in Aurora of the population are 42.9. So and it's about 37 for the white community and about 10 for the African American community, black community. So you can see the two are down basically, white and black. Latino is up. This is a number that I picked up yesterday. Haven't seen today's new numbers. This number of cases we've had in Aurora, Illinois, 1565 and 23 deaths. Today, on our website, you can look at that. The COVID-19 tracker will have an update too when this Aurora number comes in, and the COVID-19 tracker at you see the bottom of the screen, xpin.news. We have a COVID tracker there. And today, the number of deaths in Illinois went up 144. Now, when we think about deaths, who are these people? I brought this up before. I want to bring it up again. This is Elisa Garcia, who was a plant worker up at St. Charles at the Smithfield plant. Now, I forgot, I think it's still on the downside there. I forgot if they got up, if it's back yet. The county health department closed it down. They had some cases, and Elisa was one of them that passed away, I think, about a month ago. And she was a grandmother, I believe, at 64 years of age. And it's just an individual that has passed and during this virus. And I'm sure many of you know those who have been affected, those who have died. And we just got to keep vigilant, wash our hands, stay at 6 feet away, and stay at home as we can. Stay at home. So Elisa Cruz was one of our people that passed in Illinois. So what I'm thinking about, and I think the governor is too, and others, that we need more testing. And to do that more testing, we talked about in the last commentary, would be increase it in Aurora. I know of 2 sites, there might be more, but I know of 2 big sites, 2 bigger sites. One is the east side over at the outlet mall. It's averaging, I believe, I mean, their max is 600 tests a day. And then the other is the Visiting Nurses Association. I forgot where that location is, but they have do some numbers too. But I believe that we need some more good numbers here in Aurora. And that's why I'm going to throw out, as I threw out the other day, I call it the New York model. Uh, Governor Cuomo of New York brought this up at a news conference on Saturday, that's when I started to talk about this New York idea of working with the churches. Now, that little map shows some of the churches there in New York City. And here's a little follow up on that. We have some organizations that are church organizations, clergy groups that are helping to do this idea. So I've been trying to do some of that the last day here to trying to generate a little buzz on this. I hope it's working. I need your help. It's not going to work. Just, you know, we need more helps. And this is where we're at right now on this idea of getting more testing in Aurora. That will increase the helps to our minority community when we find out how much the needs are there. And if we can increase 200 per site, maybe 6 sites, 1,200, or we could do more, whatever. I've talked to some churches. I got one at least, maybe more. I think there's more out there. We're just in this early stage, so everybody's sort of like, nobody said no. They just don't understand quite what we're doing yet. So, and I've talked to the health department a little on it, and some others, but in the city too. But it's going to take some gelling here. A lot of ways to do it, but we do need more testing. We only have, I believe, about a few days ago, we only had about 20,000, a little over 20,000 tests a day. Maybe it was 22, and they want about 60. They should have about 60, and we got to have more as the time goes on here. So I need the churches. I need the hospitals, like our healthcare here, Amida Health, Mercy Medical Center. I need their help, and we need their help. I don't want to use the word me here. Uh, Rush Copley, I wish they'd be involved too, and others, and our local King County Health Department. If we could get some gelling movement here on this, and so our community could have more testing, so we could know where this virus strikes. And it's not peaked yet, so we got to do more. So that's where we're at right now on this. And I just wanted to update you. And like I said, it's a work in progress. It needs your prayers. Oh man, it needs prayer. It needs your help too. If you can help any way, you can look at my website on the website there and give me a comment or something if you want to help some way or other. Get this going in the city of Aurora. They have churches be involved in the testing test sites with our other providers, our other health providers, providing the personnel and the equipment to do that. And we hope we can get the equipment. That's the other thing out there. Hope there is enough equipment for this type of testing. If we want more testing, we have to have more equipment, and that's a big need. And I know the state and others would be working on that front. So that's my thought right now. We'll have more updates in a few days here, or maybe tomorrow, or maybe on Thursday or another commentary. So we need your help. We need your prayers to move this ahead, and we need your prayers. Yeah, and it's just your humble servant here trying to do something that hopefully can help others. Uh, Tomorrow, we're going to have Uni Camacho of Jesse Torres Boxing Club and Rock Steady Aurora. And I've been involved with Rock Steady, and I've been a friend of Uni's for several years now. And we're going to talk about, she's got well, I guess we call it a walkathon, marathon, 5K. I don't know how we're going to do. She's got plans on this. I haven't heard. I'm not quite sure how we're going to do this, but we're going to be virtual reality. We're going to be out there doing it and then report in. I guess that's how we're doing it. It's over a period of time. She's doing it too. So we're going to be talking about that tomorrow and other things related to the Jesse Torres Boxing Club and Rock Steady. There's the Parkinson's program. I didn't put that beside it, PD, to help those with Parkinson's. And that's been on hold. So people with Parkinson's, and you got to keep that exercise up for Parkinson's. It's very important. So I thank you very much for listening this afternoon, and I just appreciate you all. And be sure to tune in tomorrow. And as I can say again, goodbye. God bless. Bye bye.